Good afternoon. My name is Tom Stolz. I'm the Sedgwick County Manager, and we are here today to have the weekly update regarding COVID-19. Today is June 17th. As a country, we increased by 2.3% since Monday, so our total numbers nationally today are 2,148,357. As a state, we increased that exact same percentage from Monday to today, 2.3%. So we are at 11,681 state positive cases recorded today. In the state of Kansas, our death total is at 247. In the county, since Monday, we went up 6%. That's 764 positive cases on Monday to 810 today. And then the periphery counties, Harvey with 14, Butler 42 positive cases, Cowley 45, Sumner 9, and Reno 58. Of the positive cases that we have 514 in recovery, and our death total in Sedgwick County stands at 25. We have a little bit of testing update to talk about. First of all, we have our mobile testing vehicle up and running. It will be at Mulvane at the Pix Community Center in Mulvane. That's 101 East Main from 9 to noon tomorrow. Sedgwick County residents can be tested at no cost. We are also in the middle of our large-scale randomized test, countywide test, trying to find enough participants to do that. Residents will be, have been, and will be receiving calls this week to participate in the random sample survey to be tested for COVID-19 at no cost. This survey will help the health department determine the spread of the disease in Sedgwick County. The phone calls, if you get them on your cell phone or in your home, will come from a 660 prefix, which is a county prefix, so please consider answering that call. As usual, our residents are able to be tested for COVID-19 regardless of symptoms now at no cost through the health department. And to date, we've tested more than 21,000 residents in Sedgwick County. And if you have questions, please start through the 211 system at United Way, and that gets you going in the process. I will tell you that our first priority with testing at the health department is for those people who are symptomatic, who are sick. They are the priority. We try to get them in same day or next day to be tested. There's a second priority, and that is people who have been in direct contact with someone who is positive, so their chances are greater that they would have gotten COVID. They would be the second priority. And then the asymptomatic people, those who are just curious if they have the virus or not, would be the third priority. So if you're in that priority, when you call the health department, it may not be same day or next day. We will schedule you as quickly as possible, but recognize that when you go through the system that there's a prioritization, and we want to take care of sick people first. It's also possible that through your doctor's office or through private providers, you could also be tested. As far as I know, most insurances will cover that. So just some options as you think about the testing procedure. Sedgwick County is then also in the middle of a notice of funding opportunity and solicitation of information. You'll hear it called by an acronym NOFO, N-O-F-O. It is all about the CARES funding, which the county has received. This is a global, comprehensive type of survey that we are doing to determine needs within the community. That is on our website, www.sedgwickcounty.org, and responses are due by this coming Friday, June 19th. So you have a couple more days to put that information in, and we're hoping to get actually several hundred pieces of information on that. So we'd encourage any entity out there, government, nonprofit, business, church, hospital, consider filling out that form. And then this one last reminder, The Sedgwick County Health Department is still hiring positions through December to fight against COVID. There's a number of different kinds of and varieties of positions there. So please go to our website, careers.sedgwickcounty.org, and search the keyword COVID for those job opportunities. We had an interesting meeting today. Dr. Mins came in he is our health officer, and talked with the commissioners about the testing and tracing and the importance of that. We had a discussion about antibody testing. He talked about the importance of spacing, keeping distancing, and mask wearing. So if you're interested in that, please look at the video from the meeting this morning. It was a robust conversation. So with that, I don't have any other information. We'll be back tentatively a week from today to discuss further updates. So thank you for your time today.
Ryan Wright from KSN. What kind of reaction have you guys got from people in Sedgwick County after kind of being called out by Laura Kelly? Are you hearing people being upset, or are they supportive, or have you gotten any reaction at all?
Well, I think everybody has an opinion on how the county or how the state or how the federal government's handling COVID. Clearly, when the governor mentioned Sedgwick County, I don't know that upset's the word for it. We're introspective. We take a look at what we're doing. We do every day. One of the reasons we had Dr. Mins come in today as our immediate health officer is to give us his perspective. Dr. Mins is in a considerable contact with Dr. Norman at the state level, so we try to stay in sync with the state. I do want to remind people that the commission a couple of weeks ago voted as a body that the governor's Ad Astra plan would be our template, would be our guideline as we move forward. Dr. Mins came in with an opinion that we should be extra careful, maybe stay in a phase 2 with a gathering number of 20. Both of those are guidelines only, and Dr. Mins, even from the podium today, said that we're trending some numbers in the wrong direction. I don't think it's shocking him because of the amount of opening that we're seeing. But one thing that he said, and one thing that I've heard commissioners say, we are concerned about the lack of distancing and masking going on, so we want to remind people to continue to be responsible and do that. All of which I think that was part of the governor's point was people need to be smart, and I think we agree with her on that. We think people should be responsible and smart. But I don't think that there's anyone upset about it.
And is there a timeline, or do you have any idea on when nursing homes will be available for visitation?
We're working. We actually have our aging department along with our health department. It was recently announced. We were looking for guidance a couple of weeks ago. It's a good question. A couple of weeks ago, we were looking for guidance from KDHE on nursing homes because they license nursing homes across the state. So we were seeking guidance from them on how to deal with the issue of that we are seeing today with nursing homes. And there's two components to that. One is just the amount of cluster that's showing up in nursing homes. So it's the physical health component of that. And then the second thing, which is I would say as important, is the whole social dynamic to that, the isolation and separation that we are seeing with nursing home clients and their families. It's a national tragedy. So we were looking for KDHE to begin to give us guidance on both of those issues. Recently, the state came out and basically said that nursing homes and long-term care facilities should work directly with their county health department. So we are taking that, we'll take that charge, and we will begin through our aging department and our health department to work with our local, the Sedgwick County long-term care facilities and look at both those items. Safety, what can we do to stop the cluster spread? And the nursing homes have already been so proactive on it, they're basically locked down. but we'll look at any other avenue. And then we'll take a really hard look at the second component of that too, which is the social dynamic. What can we do to give immediate relief to families who want to talk to their mothers, fathers, grandparents in these facilities, recognizing they can't have skin-to-skin or face contact, but there's got to be a technology solution or a plexiglass solution or some type of solution to allow this kind of conversation to go on. So we will take the lead on that now, and you'll see some action within the next few weeks on that. We have to solve that problem. Thank you guys very much. Appreciate you.